This is Brian Christensen. We're going to go over the knee today. So, description of the knee: it's one of the largest and most complex joints in the body. It's designed to absorb and transmit force to the lower extremities. It's also designed to be a weight-bearing joint. Provides mobility for locomotion, meaning it allows us to it bends, allowing us to kind of be able to go side to side, forward and back, running, jumping, cutting, etc. for sport. It's able to withstand 3 to 4 times our body weight in compression. This allows us to do things like heavy back squats or landing from a high jump or something of that nature. It's a pivotal hinge joint, therefore it kind of makes it a little more vulnerable to injuries due to the torque placed in the long levers. And I'll talk about those bones here shortly, but the knee is designed mostly to go forward and back, not necessarily side to side. And unfortunately, in a lot of sport, it requires a lot of compression and side to side motion, so which makes the knee very susceptible to injury. All right, the bony anatomy of the knee. The joints, the tibiofemoral joint, it's the largest joint in the body. It's the primary weight-bearing joint in the body. It's a modified hinge joint, which allows for flexion and extension, but it has limited rotation. Then you have the patellofemoral joint and the proximal tibiofibular joint. The primary bones for the knee are the femur, tibia, and patella. The tibia is the primary weight-bearing joint of the lower leg. The femur is the longest and strongest bone in the human body. It supports the upper body weight during standing, walking, and running. It's also, it's hard to injure, but if you do injure it, it takes a long time to heal also. The patella or our kneecap is the front part of the knee. So some of the soft tissue, there's a lot of it for the knee, and but kind of the more common ones are your ACL, PCL, MCL, and LCL. So your anterior and posterior cruciate ligaments and your medial and lateral collateral ligaments. It also has cushions, which also serve as stabilizers for the knee, and those are the medial and lateral meniscus. The meniscus are C-shaped cartilage in the knee. They're cushions for weight-bearing activities, and they decrease the effect of impact between the femur and the tibia, basically allowing the bones not to collide into each other. They can be injured acutely, so one-time thing or one-time incident, or it kind of gradually through repetitive stressors, they also kind of wear out with age, which is unfortunate, since we need our knee. So the ACL is the most commonly injured ligament in sporting activities, and is rarely injured in isolation. So typically if there's an ACL injury, it comes from some form of a high mobility, high impact movement. The PCL works with the ACL to stabilize the knee. It's commonly injured when there's hyperextension of the knee, but otherwise that's its primary kind of method of injury. The LCL stabilizes the knee from outward force across the knee, and the MCL stabilizes the knee from inward force. The MCL and LCL work together to prevent unwanted side-to-side motion. However, the MCL is more commonly injured than the LCL. So the muscles involving the knee are your quadricep and the 4 muscles that make up that, and then your hamstring and its 3 muscles. These also help kind of support the knee, keep it strong. They're also, so the way that the quadricep connects to the knee are the quadricep tendons, and that'll become important here in a minute when we talk about some of the injuries. And hamstring muscles typically they're designed to kind of bend the knee. So a lot of your common sports-related injuries, torn meniscus And either menisci can be torn as a result of an aggressive twisting motion. So there's usually some compression, which kind of squeezes on the meniscus, and then twisting involved, causing a tear. The other way is a traumatic contact with the knee, knee-to-knee collision, knee-to-ground, etc. And meniscus tears are the most common athletic injury pertaining to the knee. Your ACL, MCL, and PCL tears are typically, the ACL is a one-time trauma typically, and it's a sudden twisting or an impact to the knee. This is, like I said, the knee is designed to go forward and back and a little bit side to side. So with a sudden twist to the knee, that ACL that's designed to stabilize the knee forward and back gets a lot of stress on it, can cause it to tear. PCL is probably one of the harder ones to tear, and then MCL is a lot of times your ACL and MCL tears go kind of hand in hand. Prepatellar bursitis, it's also known as nursemaid's knee, and it results from inflammation and swelling. The knee bursitis develops from repetitive motion or pressure on the knee, such as frequent kneeling on or bending of the joint. Your tendinitises and tendinopathies. The tendinitis can affect any tendon in the knee, but is more common to the patellar tendon and the quadricep tendon. So a lot of our knee pain may not be anything, may not be what we think it is. A lot of it is a lot of wear and tear on the tendons and and probably not recovering properly or stretching enough, allowing everything to get tight. Tendinopathy, however, is degeneration of the tendon. So when the tendon degenerates, it can affect the knee strength and mobility. It also causes pain. It's the beauty of getting older. The distal iliotibial or IT band syndrome is a friction syndrome, and is typically experienced as sharp pain on the outside of the knee joint. Patellar sublux is essentially the kneecap coming out of place. Sometimes it goes out and needs help getting back in. Other times it'll pop out and go back in on its own. Either way, it needs to get, even if it does pop back in, it needs to get looked at, because if it can pop out once, it can pop out again. And then lastly, a patellofemoral syndrome or runner's knee, which this is when the patella doesn't track correctly within the patellofemoral groove. And pain from patellar ligament will be present during athletic activity, and particularly exercises that result in repetitive bending of the knee, such as running activities. And yes, it's essentially the grooves are not either kind of worn down, so it's not allowing the patellar tendon to glide directly or to glide like it should, and it kind of allows it to skip a little bit. So if there's any questions, just message below.